Good morning, everyone. Bonjour tout le monde. This morning's roundtable with Green Party Leader Annamie Paul, Green MP for Fredericton Jenica Atwin, and special guest panelists Senator Pate, Paola Ardiles, Elyse Schipper, and Dr. Christine Weckerly will now begin. La table ronde de ce matin avec la chef du Parti vert, Annamie Paul, la députée verte pour Fredericton, Jenica Atwin, et les invités spéciaux, la sénatrice Pate, Paola Ardiles, Elyse Schipper et le Dr. Christine Weckerly. Maintenant, commençons.
Bonjour tout le monde. Good morning, everyone. Thank you for being with us today. I'm here on the traditional territories of the Mississauga of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat. Je suis ici aujourd'hui sur les territoires traditionnels des Mississauga, Anishinaabe, Haudenosaunee, et Huron-Wendat. And I'm very pleased to have our special guest with us today during National Mental Health Week to discuss the state of mental health here in Canada, pre-pandemic, during this pandemic, and post-pandemic as well. And I'm so grateful for them to have taken the time to be with us. This is an important conversation that we're having, and we're certainly going to be having more of these. Many of well, certainly myself and Jenica as politicians, and I'm sure all of the panelists as well, have heard anecdotally what has been confirmed through studies and surveys throughout this moment, which is that we are really facing a mental health crisis, one that existed before the pandemic, but has only been exacerbated by it, and that we have to prepare now to address now and prepare to deal with after the pandemic as well. And that is what I hear in my conversations with the community and with youth, that this is really one of the top preoccupations that they have. And you may have seen that over the last couple of days that there was a recent study published by Ipsos, the first in 2 years for them, polling Canadians on mental health. And the news is very stark. It confirms, again, what we have heard anecdotally, which is that the number of Canadians that are experiencing some combination of debilitating stress, hopeless depression, consideration of suicide or self-harm has increased dramatically. And in the case of this poll, they reported an increase from 33% to 50% this year. They also reported that nearly 1 in 10 Canadians seriously considered suicide or self-harm several times over the past year, and that at 13% have considered suicide at least once. We know the pandemic has disproportionately impacted low-income Canadians in many different ways. One of them is also their mental health, with a far larger proportion of those making less than $40,000 a year considered to be high risk when compared to other groups. And then for youth, as I said, when I speak with youth, they tell me that this is one of their top, a couple of concerns. The Ipsos poll that was just released reported that 76% of youth reported mental health challenges. And so, as Jenica had said earlier, last year during the pandemic, sounding the warning about an echo pandemic of mental illness to follow in the wake, now really is the time to talk about what we can do to protect people and help people right now, and what are the long-term strategies for the future. Alors, dans cette semaine de la santé mentale, c'est très important de souligner qu'il y a une crise qui est en train de dérouler à travers notre pays. Qu'il y a beaucoup de personnes qui sont en train de vivre un moment très, très difficile. Le sondage qui vient juste d'être publié par Ipsos confirme que le nombre de Canadiens qui ont connu une combinaison de stress débilitant, de dépression désespérée et de prise en compte de suicide ou de l'automutilation, est passé de 33% à 50% cette année. Que près d'un Canadien sur 10 a sérieusement envisagé à se suicider ou se automutiler à plusieurs reprises, et que 13% ont considéré le suicide au moins une fois. On sait que la pandémie a vraiment fort touché dans une manière défavorisée les gens de faible revenu au Canada. Et la santé mentale est encore un aspect de cet impact négatif disproportionné vécu par les Canadiens à faible revenu. 60% des personnes de moins de 40 000 dollars de revenus sont considérés un risque élevé de problèmes de santé mentale. Et moi, je sais à travers mes conversations avec les jeunes autour de notre pays que les défis, que les problèmes de santé mentale sont très, très, très élevés. Et le sondage d'Ipsos a confirmé que 66% des jeunes notent qu'ils souffrent d'un type de santé, de problèmes de santé mentale. Alors, c'est le moment de penser considérer comment est-ce que nous allons protéger et soutenir les gens maintenant pendant ce moment très difficile, mais aussi quelles sont les stratégies de long terme aussi pour vraiment démonter les problèmes systémiques dans notre système de santé mentale. Et je suis très contente d'avoir nos invités aujourd'hui pour nous guider dans cette discussion. Et je vais les laisser leur introduire. We have Jenica Atwin, our Member of Parliament for Fredericton, Senator Kim Pate of Ontario, Paula Ardelas, our senior, I said ours, well, not ours, not yet, a senior lecturer at Simon Fraser University, Elyse Schipper, Executive Director of Parents Lifeline of Eastern Ontario, and Dr. Christine Weckerly of McMaster University. So if you could kindly just introduce yourself, and then I'm going to just guide us in a discussion on these topics. And can we begin with you, Jenica?
Sure. So thank you so much. I think anytime we can get together and talk about this, we're moving the needle a little bit. So I'm just so appreciative of this opportunity and to be surrounded by such powerful women as well. I think it's no coincidence that we're all here together as strong women addressing this issue. And so this is very much a passion of mine. It's been one of the key reasons I wanted to get involved in politics because it really stems from my time working in education with youth. And I'll never forget the first time that someone came to me with experiencing suicidal ideation and the feeling I had not knowing what to do in that moment. And it led to thankfully gaining some of those skills and being able to help and to be able to refer and direct and feeling a bit more confident in those moments of crisis. But to take that on as an individual is something that is extremely overwhelming. And we need all levels of government, we need all levels of our society and our communities to come together and really tackle this head on. And as you mentioned, Annamie, this existed long before the pandemic. But I'm fearful, for what we're facing right now. So it couldn't be more timely to have this important discussion, and I'm just so thankful to be here today. And I'm coming from the unceded Wolastoq territory here in Fredericton. Thank you.
Thank you, Jenica. Senator Pate.
Thank you very much. I come to you from the unceded, unsurrendered territory of the Algonquin Anishinaabe on the beautiful Kitchissippi River, and you can probably hear the pounding of their building here on Parliament Hill. And I want to thank you very much for inviting me. This is such an important topic. As someone who has walked with and has in my own family many people with mental health issues, we've lost people to suicide, seen people really struggled with depression, homelessness, and not having access to the basic supports they need. I think the integration of mental health, and as you pointed out in your introduction, so important that it is disproportionately those who are most on the margins that are experiencing, whether it's because of race, gender, economic deprivation. And we know in this time, it's those who are struggling most because they don't have a way to support themselves. They don't know what their future is going to be. They're homeless. And not surprising, this not only exacerbates pre-existing mental health issues, but actually creates new mental health issues. And then you layer on that, an area that I worked for a long time. In fact, my first work with mental health was I was part of what was then called a crisis center, would now be a homeless shelter, would be, and we did what we called suicide flying squads, which literally meant when someone called and said they were feeling hopeless and helpless, we would go and physically be with them. And I was only a teenager, and it had such a significant impression on me. And then I did postgraduate work in forensic mental health, because when I started working with young people, men and women in prison, I realized the devastating impact of not just incarceration, but those who have mental health issues are more likely to be held in the most isolating conditions, and they get more and more ill because of those conditions. And so I think we are in a moment where not only are we seeing what was a dire situation before the pandemic exacerbating those pre-existing conditions. And even though the government has done a great job on rolling out benefits for many people, we know that depending on which measures we use, at least 1 in 7 or 1 in 10 people has received virtually no support. And that's an egregious situation. And I think it's partly a function of who ends up often in these positions of power, and the degree of privilege, the lack of awareness of how hard it is to access these services if you can't afford to pay for therapy, if you can't afford to pay for those supports, is vitally important. So I want to thank you very, very much, you, Annamie, but also the Green Party and Jenica, and all of you for the incredible work you do every day, because it will be the work, the collective work of taking responsibility for all of us that will change this. And I'm very excited about the work you're doing, and that we can continue to do together on behalf of all people in this country and in fact globally.
Thank you so much for that. Ms. Ardales?
Thank you so much for having me. So I came to Canada when I was 5 years old, and I came from a family who had to immigrate because of the dictatorship in Chile. So that experience growing up and seeing how the impact of trauma from that pre-migration period had on my community, and also the post-migration issues in terms of learning to become part of this society, had lots of challenges. And so I got to experience that at a very young age. And what it was really incredible was to see the challenges, but also the incredible resilience of my community and the diaspora. And I started to notice that, and became really fascinated with the whole issue of how can we think about mental health, not just from the perspective of mental illness, but how do we actually produce a good mental health so that we can all have opportunities to flourish. And so that's really the vision that I hold, and ended up stumbling upon a career in public health, which really does align with that vision in terms of making sure that we all have the supports in place, whether it's employment, whether it's education or housing, that are really the foundations, the preconditions to actually have that good mental health. So I'm really, really honored to be here and contribute to this conversation.
Thank you so much. Ms. Schipper?
Hi, thank you so much for having me here today, and for letting me be part of this amazing panel and really important discussion that is something that I'm so passionate about and have been for many years. I'm here today as the executive director of PLEO, which is a nonprofit organization that supports parents whose children to age 25 are struggling with mental health or addiction or behavioral challenges. So my day-to-day work is really immersed in what these families are experiencing as their children are struggling, as they're at risk of death or chronic suffering, or as they're just discovering that things are not okay, and they don't know where to go. They don't know where to turn for help. But I came into this position after a personal family experience of discovering kind of the ravages to a whole family of mental health suffering. And I also come to this discussion as a mom, concerned about my own child's well-being and my child's friends and all of the kids in our neighborhood and all of the parents in our neighborhood who are trying to weather what has been a marathon crisis on top of a crisis that already existed before in mental health. My experience in this field has been very much with the people who are struggling, but also with people who are doing something about it. So while I live in the urgency and I see how devastating it is and how tragic it is and how scary it is for anyone who sees what the statistics are or has experienced this firsthand, I've also seen how incredible it is when people who have been touched by this do something about it and create innovations and bring communities together and put their passions to good work and create interventions that work and interventions that care about people and parents or youth or whoever who has been touched by this say, what we're doing right now isn't good enough. We believe that everybody should have a chance to flourish. And so I'm hopeful about that spirit and the, pockets of that initiative and innovation that are happening all throughout the country. And that even though what we'll talk about today is scary and devastating, there is so much hope and so much possibility for what we can do about it.
Thank you so much. Dr. Weckerly. Oh, you're on mute.
I always do that. Good morning, bonjour. Happy to be here. I'm Chris Weckerly from the Department of Pediatrics at McMaster. My background is PhD in clinical psychology. I'm a scientist and also affiliated with the Offord Center for Child Studies. And just to pick up on the things that were mentioned, we have been seeing the United States CDC has shown a trend over 10 years of increasing youth suicides, with disturbing trends in the 13 and under age group. And so rather than seeing this as perhaps only a wish to die, this is perhaps the biggest call for help, an indicator of the level of distress. And for our own Canadian youth, we know that a sizable number who are reporting distress say that they cannot talk to their parents about it. So it's that combination of increasing distress, increasing uncertainty, and not quite knowing who you can talk to and being prevented from connecting to your peer support group through various COVID changing measures. And at the same time, we want to remember that the youth are in an age of exploration and discovery and resilience. And there's a great deal of creativity, but they need some basic supports. And one of the pieces that we've been focusing on the last 2 years is how can we give some kind of a support that's there for them 24/7, even if they're on a wait list to see therapy, or even if their caseworker visits have been disrupted. And we focused on joy, and we have an app called Joy Pop that has shown positive results in dropping depression scores and increasing emotion regulation, even after 2 weeks of daily use. So we have peer-reviewed article out. You can go to youthresilience.net website for more. But this is the way. So I'm trying to proceed is in terms of adversities come like tsunamis or little trickles. How can we galvanize our inherent resilience skills and pick up some strategies?
Mm-hmm. Thank you so much for those introductions, and we're going to just jump into it now and pick up on some of the themes that you raised in your opening remarks. Senator Pate, and yes, I know that you want me to call you Kim, but I want to make sure that those who are joining us also know the important role you're doing, the work that you're doing in the Senate. But Senator Pate, you mentioned the layering almost, the root, the underlying causes of much of the mental health strain that has occurred during the pandemic. And I really just wanted to dig down into that a second and ask any of you who want to comment on that to do so. Because for instance, when I speak with all of the various groups of people that I speak with, and they talk about mental health, it's usually these days in the context of the uncertainty. I don't know if I'm going to keep my job. I'm worried about keeping my family safe. I'm worried about my studies. I'm worried about my kids being out of school, or my kids are, it's layered with those, these other social issues. So I'd like to hear maybe a little bit more about that. I mean, during this pandemic, what do you believe accounts for the spike in mental health fragility? And I'm just going to, I just throw it out. And so anyone who wants to contribute to this, feel free.
It's Paula. Oh, sorry.
Paula, and then we'll come to Dr. Reckerly.
And I forgot to actually introduce myself. I went into the story of what brought me here, but I'm actually here on the unceded territories of the Squamish, Musqueam, and Tsleil-Waututh people, and I'm based at Simon Fraser University in the Faculty of Health Science. So I think that one of the things that I've noted just in the conversation is that I'm part of a global working group, the International Union for Health Education, Health Promotion, and we just put out a position statement which actually really matched the points that you just spoke to, and some of the issues were around the far-reaching economic consequences of for example, the rising rate of unemployment, which of course we all can understand the incredible financial stress that has caused. I would say particularly for those who have not had the ability to actually stay at home, and not having paid work days, I think is really a fundamental issue that we need to address immediately if we, first of all, want to get out of this pandemic, but second, if we actually want to address the issues of inequities in this country. And the other one that I wanted to point out is the issue around isolation. So when I mentioned earlier, one of the most important strategies in terms of promoting that good health that I mentioned earlier is actually the issue of social inclusion and community connection. And so, of course, because of the lockdown mandates and all the measures that we've needed to put in place to keep us safe, that has, of course, had the other consequences of now feeling much more disconnected from others. Many people, especially those, of course, we've heard about the elders living in the long-term care homes and the experiences of not having somebody touch them in over a year, of course, is going to have a really incredible detrimental impact on their mental health. And then, from the education sector, I am also a parent. I've also witnessed those challenges in terms of even the uncertainty, like, are we actually going to be able to finish school? Are we going to have to, work from home? All of those uncertainties right now, I think, have really exacerbated the issues. And the last one that I want to mention, because I think it's also the one that often gets neglected, but is actually rising, unfortunately, is the issues around gender-based and family violence, which of course is another huge factor that is part of the increase that we see in the mental health issues in our communities.
And Dr. Reckerly?
Yes, just to pick up on that, we know now from the literature that there is increased risk for domestic violence. We also know that there is increased concern about child abuse and neglect, particularly with infants. The child abuse and neglect concerns is strong. And those normal protectors, school, pediatricians or family physicians, doing Zoom calls don't necessarily have as good an opportunity because you need to speak in privately with the person. So that we need to be working towards creative ways where we can be in, physical contact with people, but in a safe way. And I think we have not tapped our great creativity to help solve some of these problems. And we can look to other places that have done some innovations. This is a time where if physicians or healthcare providers or others don't know how to respond, to maybe think about looking what's out there for free. And the McMaster University has a Vega project. It's a about 1 day series of modules that is designed for care providers, practitioners to recognize and respond safely to family violence. It's a free course, evidence-based. And so there are many things out there that I think we can be doing to increase our skill level and to help be more aware of those opportunities to have a teaching moment, to intervene constructively.
Yes, and Jenica, you know, you when we were talking about the CERB and the clawbacks that had been planned for the CERB, you made the point of drawing that link to the mental health there's just the strain that would cause, for instance. I mean, beyond that, you know, we worked on that was mostly resolved, almost mostly resolved. But you know, what are the stories that you're hearing? And then after that, I'll be interested to hear from you all. We always try to do two things: talk about, we are still in this pandemic, what can be done now? What are the missing pieces right now? And we've heard a little bit of that, but I'm just want to ask you about that, and then we'll talk finally about the long term. But you know, as someone again who's an MP and hearing from people in the community every day, what are the stories that you're hearing?
Yeah, so I mean, absolutely, the financial stress, that's a big one. And that can be some of the most difficult problems to solve, is because it's so multifaceted, and you know, we can't make jobs, you know, reappear right now. And the other big piece is the concern for youth, children and youth. We have so many parents calling us, even as a federal MP, as kind of their last resort, is what they say. I don't know where else to turn. I know you're interested in mental health. What can you do to help me? I'm so concerned. There's nowhere to go. I'm told I'm on an 18-month waiting list for my daughter, or that I'm going to have to pay out of pocket this much money, which we can't afford, which is increasing their stress as well. I've got my own nieces and nephews that I'm greatly concerned about, my own children as well. You know, and it's that social regulation piece too, you know, it's just they're regular people who are there to kind of keep them grounded and, you know, to keep them more balanced. It's just they don't have that access point. And I'm not sure, I mean, what the data would suggest around this, but I do have concerns around social media as well. And I know right now it's kind of the thing we have to, you know, to occupy our time. And so many children and youth are turning to it to you know, for their boredom. But I'm worried about kind of the doom scrolling, or getting bogged down in all of the negativity and just all of the darkness that can bring. And so I have concern about where that's headed, and the long-term trends associated with that as well. So I'm by far not an expert in that field, but I've just been noticing. I'm just, you know, and my recommendations to my niece, for example, anytime she's kind of, you know, struggling a little bit, I'm like, have you taken a break, you know, just from social media for a little while, and just connect with the real people around you, and have these conversations. And you know, even here on the East Coast, where we've been so fortunate. So thankfully, our kiddos are still in school right now for the moment here in New Brunswick, but that's the added piece, to have children out of school. Not even just with that other, you know, adult, you know, that teacher-student relationship is so important. The other adults, you know, in the buildings that will be so helpful, guidance counselors, gym teachers, anyone that they're going to be interacting with, and of course their peer group. So I'm just, you know, that's my great concern, and that's very much what we're hearing from parents that call into our office again, is, you know, just what do I do? You know, they're at a loss, and when we know the resources are so limited. But I do have to hold on to that hope piece as well, in that I really believe the solutions exist, because I've had the pleasure of meeting with so many incredible not-for-profits and organizations, and they have incredible models and plans and pilots ready to roll out, but it always seems to be a funding issue. So that's really where I hope to you know, play a role to advocate for that more consistent funding on an increased basis that's based on need. You know, so there's so many ways that we can go about this, but it's just nice to you know, have these conversations so we can kind of get everyone out of our silos as well, because I think all of, you know, getting those experts together and really putting our, you know, our money where our mouth is, I think is an important piece to this.
Yeah. So turning now then to this moment, and continuing to talk in this very holistic, interconnected way, what will make the biggest difference at this moment in terms of improving the mental health of people in Canada? What is the combination, you know, the prescriptive combination of things that we could suggest? You know, with investments, yes, but the rest as well. Senator Pate, do you have any thoughts on that?
I do. And I think,
I knew you would.
When CERB was rolled out, it was amazing how quickly people who were incredibly anxious, who didn't even know they were one paycheck away from poverty, suddenly had comfort. We could do and implement a guaranteed livable income. We could implement a pharmacare program. We could invest in housing. And we know when we do that, and of course, jobs are important, but for people who can't work or who are caring for elderly or children or people with disabilities, then providing those supports, because as it was summarized by someone just yesterday to me, it was like, and you pardon my language, but it's we're told all the time we're F-ups. I won't use the word, but and then when we try to get ahead, we're pushed down. If we try to get, we try and help out, and we accept CERB and a volunteer. I was talking to people who got their employers actually encouraged them to apply for CERB so they could volunteer because the employers couldn't afford to pay them. And then they get characterized as layabouts because they're not going to work. Well, they are going to work, but we don't amplify the types of incredible, innovative ways that people got together and helped each other during this period. And I think we can do that. And, my mom died in long-term care during this period. It was awful to, and it was essentially, as was already raised, because we couldn't get in. And, the fact that long-term care relies on a business model that presumes family members will be helping take care of people is part of the problem. That's how, she didn't die of COVID, but she got a sore that got out of control and wasn't noticed and otherwise would have been. And she was in these multi-million-dollar homes, but she was in a good home. My family is working class background. And so, but she was in a decent home and was well taken care of. But I remember when I was working with homeless young people many years ago, we partnered between a seniors home and the homeless shelter and had, what the kids called adopt a grandparent and the seniors called adopt a grandchild. And, I was thinking during this time, we could have created some of those bubbles there. The woman that I met who's working full-time and the minimum wage job as a personal support worker, living in a shelter in the shadow of Parliament Hill, is horrific, but those are realities. And I think we should both be telling the stories so that our colleagues know, because perhaps they are a bit out of touch with that reality or have never experienced that level of economic deprivation themselves, and make sure they know those ideas, know those situations, but then propose the options. And I think there are options. And if we invested in people, if we did tax reform, if we followed some of the recommendations the Parliamentary Budget Officer has made about how we could have a more redistributed income situation in Canada, if people could know that they would have health care, including mental health care, pharmacare, that they would have housing, that they would have, at least a minimal support like a guaranteed livable income, they could do all kinds of things to assist each other and themselves. And that would create, peace of mind for many people that they don't have right now. And so I know you're already on this page, but we need to get the rest of the folks who may never have experienced this. And it's fabulous that Jenica's raising these issues, but there's a lot of folks, members of Parliament and senators, quite frankly, who are pretty male, pale, and stale, and also come from a fairly wealthy background, who I think we need to educate them about this as well.
Thank you, and I'm very sorry for your loss. I didn't know that, and your story almost mirrors exactly the story of my father dying in long-term care during this period as well. And I think we're going to be hearing thousands of those stories over the years to come, really. Elyse, I wanted to turn to you for the kids. What would make a difference now that we're not doing? What would be the thing that would have the greatest impact? And then after that, I see our time is running very short. I'm just going to pass it back to you all for just some concluding thoughts again about looking beyond the pandemic. We've talked about some of those things again, but if anyone wants to add something that they haven't yet, we'll have the last couple of minutes for that. But Elyse, what would make the most difference right now?
Well, what I'm seeing will echo much of what has been said already, which is that there was a crisis in mental health before this started. And the pandemic has really exacerbated a lot of the challenges that families were already experiencing, and started new challenges for families who weren't experiencing them before. But when we get phone calls, for example, from parents, we've always done this. They call and they tell us they're concerned about their child or their young adult. And we help kind of parse, what are the challenges? What are the opportunities? What are the strengths? What can we figure out as next steps for a plan forward? And as part of that discussion, it's not just what are the symptoms, what's the diagnosis, it's what else is going on in your life. What are all of the social determinants of health that we talk about, all of the other contributing factors? And we hear from parents about, I'm worried about having food on the table for dinner tonight, or I have no support, I have no family, I have no neighbors, I don't have anyone who can help me. I have to work 2 jobs, so I can't be here for my child. I keep getting calls from school that they're getting kicked out because they don't know how to deal with them there, but I don't have time to support them at home or to go in and have meetings with the staff, or they won't listen to me because of how I look or what my accent is, or because of, what credentials I may have or not have. So that there's a whole bigger picture of all of the different things that are contributing to a lack of mental health. And I appreciate that when all of you have talked about what we have to do. It's not just about the mental health issues. It's about making sure that people have a livable income, that they have access to nature and green space, that they have education that is culturally appropriate and safe space. I think some of the things that have been really, impacting kids right now are the lack of people whose eyes light up when they walk into the room, either because they don't have those people right now, their bubbles are so small, or because everyone is so tired and burnt out themselves. I think, the debate that always comes up, or the rebuttal that always comes up about investment is, there's only so much money to go around. What are we going to pay for? And right now we're in a situation because of the mental health crisis before the pandemic, and especially now, that we do need emergency money to deal with the emergency situations that we're in. But we also need money in community mental health and prevention and public health to help stem the tide, so that we're not dealing with this even further in the future. But the cost that we don't think about is what happens if we don't invest, and that's even greater than if we do invest now. We're talking about kids and families who will not survive if they don't get the mental health treatment that they need. And we're talking about parents who will not be able to participate in work, who will have their own mental health struggles if they don't have the supports they need to take care of their kids. So I think we need to look at the long-term, medium and long-term impacts of the investments that we can make now, so that the argument about I don't want unbelievable taxes for my kids doesn't make sense if you look at what the impacts are of investing now and getting ahead of those costs. Talking about how can we afford mental health care and also a guaranteed livable income? They're connected. Or how can we make sure there's green space and all of those things? They're all connected. It's all possible. There are, as Jenica said, amazing ideas and innovations out there. The communities know what they need. Parents and youth, they know what they need. You ask them, they will tell you. You can find things that are working. The information is there. The will is there. We just need a partnership between the people and the communities and government to make it happen, and to say, we expect that everybody gets to flourish. That's our expectation for everybody. We don't accept anything less.
Yeah. Thank you very, very much. And really, thank you so much for that. I've done panels with a couple of our guests before. And so the point that you make, they also make about the cost of inaction, that it doesn't come for free. It's not free to not do anything. And we really have to keep emphasizing that. I see that our time has expired, and we want to invite you back multiple times. When we speak about an issue, we really try to keep talking about and keep providing a platform for those of you who are doing this work until we see the action. So we try to keep it short-ish. And so maybe what I'll just ask you to do, and I know that I don't like doing this, but I still want to give you all the chance for one last word, is just to say, the one thing right now that you feel would be most impactful right now, and then the one thing that will be most impactful if we plan for it so that we're implementing it after the pandemic. And I'll start with, and I'm going to keep you to it just because I know we're a bit over. Dr. Weckerly.
Thank you so much for this conversation opportunity. The one thing I would like to emphasize is that we need all partners, and I'd invite corporate Canada to get involved. TELUS did a great thing in providing 2 years free cell phone plans to youth transitioning out of foster care, and that made huge differences in their lives, that they didn't have to make a decision between buying food for that month or getting a cell phone that they need to go to work and maintain their connections. So
and the long term? The long term?
The long term.
The one thing?
The one thing in the long term, I hope that we can foster creative ways for social connectedness, because that's the top predictor of resilience.
Thank you so much. Paula?
I think
short term, long term?
Mine is kind of both, I think. I think the pandemic has really, of course, made very visible how connected social inequities are to mental health. So let's reduce the social inequities and we'll definitely be improving mental health in the future and now.
Elyse?
I would say for right now is making sure people can cover the basics. When we talk about mental health and the things you need to have covered, we say food and water and safety and nature and connection and some meaning and purpose. So there are some basics there we need to make sure everybody has covered. Food and water and a safe place to live is kind of the immediate. In the long term, I would say we have seen this year how everything can change really quickly, how resilient people are, how quickly we can pivot, how we went from can we do virtual care to only virtual care? So let's not waste this opportunity when there's the relief of this immediate safety of the pandemic to do things differently, and continue with that momentum and that open mind and say, we don't want to live like this anymore. We can do things differently. We can mobilize and just run with it. Let's not waste that opportunity.
Fantastic. Jenica.
So immediately direct fund organizations who are doing incredible work on the ground right now. And in the long term is centering our well-being. That should be the measure of our success. So that's what we've been pushing even before the pandemic, but it's never been more important.
Senator Pate.
I would say as we move out of this, that human well-being, not GDP, be how we guide, how we move forward out of this pandemic. And longer term, that if we go according to the Sustainable Development Goals on how we develop as a nation and globally, then we'll do this in a way that's sustainable and benefit generations to come.
Thank you so much. I love concluding in this way because, you know, you're in different parts of the country. I can confirm to everyone that many of you have not met before, but the consensus amongst those who are closest to the issues always comes through in terms of what could be done and what should be done. In our case, in the short term, we are pushing for those immediate needs to be met, the ones where we still see the holes. Through a residential tenant support benefit, because we know many low-income people are right on the cusp of evictions. Also through help for our youth who are just terrified about what they're going to be doing this summer. The jobs are not there, we're still in lockdown, and they're really in a hole, and it's a big mental strain. And then in the long term, of course, absolutely completing our social safety net. So we're not back here again. So that we've learned those lessons, and so we can take that weight off of people that causes many people mental strain. I will also mention just briefly, in the short term, we are pushing very hard for decriminalization and a national safe supply, because we have heard the stories about how mental health has led many more people to self-medication under very dangerous circumstances. And we have record opioid-related deaths in the country this year, and it's ongoing. So, merci beaucoup, merci infiniment à tous nos invités. Merci pour vos suggestions, merci beaucoup pour votre militance, c'est très important. Nous allons vous inviter encore une fois C'est clair que il y a un consensus que dans le court terme, il faut investir dans les programmes qui peuvent aider les gens directement et immédiatement. Il faut assurer que nous avons les prestations, que nous avons les programmes d'urgence pour aider les gens parce qu'il y a encore des lacunes qui existent. Et dans le long terme, il faut repenser comment on évalue la qualité de vie, quelles sont nos priorités, comment nous allons terminer et compléter notre filet social aussi. Alors, merci à tout le monde. Merci infiniment d'être ici avec nous. We will be sure to invite you back. Thank you so much for bringing your advocacy to National Mental Health Week. And we hope that this conversation, as you all said, will provide an additional little bit of impetus, a little push forward on these incredibly important issues at a critical time. Merci beaucoup. And thank you to everyone who joined us.
Thank you, merci.
Thank you so much.
If you could all just hang on for one moment, we're going to say goodbye to our friends on Facebook.
Yes, thank you, Ms. Paul. This ends the Facebook Live portion of the press conference of the roundtable. Thank you so much for joining us. Ceci met fin à la partie Facebook Live de la table ronde. Merci beaucoup pour nous rejoindre.